In my role, ensuring communities have the medicines they need when they need them is both a responsibility and a calling. Part of my work is aligning facility forecasts with actual consumption, validating stock status reports, and enforcing standard operating procedures for health products and technologies management. But it's not just about numbers, it's about people. I engage with sub-county and facility teams, troubleshoot supply chain gaps, and ensure accountability at every level. When a mother walks into a clinic and finds the medicine her child needs, that's the impact we strive for. And from experience, access is not accidental. It's built through strategy, collaboration, and relentless follow-through. That's the heart of my work.
My name is Abdullahi Mneng, working at Tanga City Council as a city pharmacist. To ensure availability of medicine, we are approving demands from facility directed to MSD through orders. We enhance proper utilization of collected funds and supplied for procurement of medicine that are affordable to the community. Happy World Pharmacist Day. Think health, think pharmacist.
One of my greatest priority in the county is ensuring access to medicines for the clients who are patients that we serve on a daily basis. This year's theme for the World Pharmacist Day is Think Health, Think a Pharmacist. And as we all know, the greatest tool of work for a pharmacist is a medicine. And as the slogan goes, no medicine, no program, and therefore no care. Availability of medicines and the access to medicines is very key for better healthcare.
As we celebrate the World Pharmacist Day, I'd like to point out some of the contributions that the Nairobi Pharmacist and the Health Product and Technologies team in Nairobi has been able to do to ensure availability of supplies and medicines to our patients. First, I'd like to point out the strengthened governance structures in our county. Right now, we have a Directorate for Health Product and Technologies. I think one of the counties to have, the first counties to have a directorate. We know that when you have strong governance structures like we do, you have better coordination of all of the resources, better coordination of the human resource and all. And with this directorate that it has a multi-cadre representation, we are actually able to meet the needs of our people. Number 2 is HPT financing. Recently, we did a quantification and forecasting exercise, and from this activity, we were able to see the gap in allocation versus the need of the patient. And through this, we've been able to better have evidence-based approach in resource advocacy, and our budgets for HPTs are increasing. And since it is evidence-based, no one really argues with you. They are able to put the money where it is needed. And number 3, on technological advances and innovations, we have also partnered with In Supply Health in management, in development of the strategic management resource tool that is basically a tool that is AI enabled and feeds into our quantification information and VEN and ABC classification of all HPTs. So it helps us in management, it helps us in prioritizing our resources right from the county to the facilities. When I get an allocation from the county, I use this tool to help me know how much to allocate a facility. And this is, as I've said, is based on the quantification that we did recently. So it's on need and priority. And also at the facility level, once they get this money allocated to them from the county, they are able to run in the tool. And from that, they are able to also know exactly what to buy, and which also feeds into what they quantified and prioritized. Prioritized, yes, but also on need basis. So what we have in the facilities right now is exactly what we need, and it helps you even to know how much of that to buy to requisition in terms of quantities. It is more efficient in terms of time saving and of course accuracy, as opposed to doing so many calculations where you can have mistakes and errors.
Pharmacies are the first point of care for many patients, especially in our country. So with the country having signed a declaration, and it's an international declaration, to make sure that they prioritize primary health care, pharmacists now need to be on that journey to make sure that primary health care is actually something that's on as part of their priorities. For us as pharmacists, or for me as a pharmacist practicing in community pharmacy, I am responsible to ensure that the community around me gets the best out of the services that we are able to offer. So when a patient comes here and they want, whether it's family planning, whether it's they have a condition with their child, we are more inclined to make sure that we are able to follow up, make sure that they get better. And if they need to be referred to, we are able now to do those referrals.
When the client comes here, you may not know whether they want the family planning service or not. So we will meet at the front desk there. So if the client wants family planning, is when I'll tell the client, I have a private room behind here, a safe space, where you can come and ask me all the types of questions and I clarify, and then it will be easy for you to select the type of family planning you need. If there is they have no knowledge of any family planning method that exists, in that case we will start from scratch. I'll describe for them all the family planning methods. I have some on these charts here, and then after that guide them towards choosing what they really need. So if they decide they want a short-term method, that one I can provide. Currently we provide only short-term methods, which include DMPA, AC, DMPA, IM. We have COCs and condoms and e-pills. Now that one we will decide. But if they want long-term, now I use my referral forms here. I refer them to the Kajiado East Sub-County Hospital, which we call Saitoti. It's very good that we are now offering family planning services, accredited family planning services in pharmacies. I wish that the project should continue to be supported. Other people should get in so that the pharmacy profession can also grow.
As a pharmacist, I'm involved in the whole supply chain management, from focusing on quantification, product quality, all the way to patient education and counseling during the dispensing period. The first critical thing to ensure access to these HPTs, the communities, is accurate forecasting and quantification. This is an exercise that we've been doing every 2 years with the support of our partners, and it has enabled us to know the needs which we share with the county health committee for budgetary allocation at the county level. So this has helped us to get the almost the right budget allocation better compared to the other years. On issues of patient care, we are focused on patient safety, and that's why we promote rational drug use. Other than that, we check on the product quality, reporting on poor quality. We have had many cases, but have been solved so that the patient don't get harmed by the poor quality in advance. All in all, I can say we work with other stakeholders to ensure access and quality to our community. Think health, think pharmacists.